Good morning. This is Thursday, February the 11th, and this is our weekly COVID-19 update briefing. On this past Tuesday, Governor Edwards announced that the state would remain in the modified Phase 2 for the next 21 days. So nothing changes for 3 more weeks, but he hinted that if at the end of that time the trend and number of positive cases improve, we might look at relaxing some of the existing restrictions, but that's just speculation at this point. All 64 parishes continue to experience the spread of the virus, and the governor stated that the number of cases is at an all-time high and that they haven't peaked yet and going to get worse, so it is doing just that. The state's most recent percentage of positive cases was only slightly increased from 11.5% to 11.6%. So it's still, though, higher than our desired goal of 5% or less. It's been reported that about 2/3 of states are experiencing a surge in the virus, and now 1 year later, after the first year of the virus, the death in the United States is close to 470,000 people. The first known variant of the pandemic, the virus, is now in Louisiana, and other variants are emerging. Some medical experts say that the vaccines that we have and are developing are effective against these variants, but that more research is required. The CDC indicated that the variants from the United Kingdom and South Africa are more contagious than the original virus and will transmit at a higher rate, resulting in more people getting the virus, more people hospitalized, and regrettably more deaths. There is some speculation that the United Kingdom variant may be the predominant strain by March of this year. There have been serious problems in distributing and administering the number of vaccinations that had been projected. The governor has recently indicated we should get more vaccines than we have been getting in the past, and get that this next week. And we should also get better notice of what number of vaccines we're getting so that we can plan accordingly and make sure no vaccines are wasted. The previously announced priority for individuals to receive the vaccine for Phase 1A and 1B Tier 1 have not changed, and we went over those last week. But what has changed, that the governor announced in his most recent press conference, that there is now a new category added to this. On Monday, February the 8th, the governor said that new categories that are eligible for the vaccine include the following: persons aged 65 and older, first responders to serve as vaccinators, law enforcement and other first responders, dialysis providers and patients, ambulatory and outpatient providers and staff, behavioral health providers and staff, urgent care clinic providers and staff, and number 8, community care providers and staff. The vaccination for the general population is still projected to be in the May-June timeframe, but while we're still in this pandemic, the federal government has ensured that the vaccines are available to those who need without cost to the individual. No one should have to pay for these vaccinations. Eventually, pharmacists, clinics, drugstores, and other outlets in all 64 parishes have or will have some quantity of vaccines. But there's recent evidence that people are still very reluctant to get the shot. A recent survey indicated about 1 out of 3 people just don't plan to get the shot, and that's regrettable. But the demand still far exceeds supply. And it's a reminder that you should get an appointment and not just walk in or drive in expecting to get the shot. You should make an appointment. As we previously reported, it takes approximately 75 to 85% of the populace being vaccinated to achieve herd immunity. The effectiveness of the vaccine will be minimized if large numbers of people refuse the vaccination. Also, as we repeat every week, there's a large number of people who are asymptomatic. They have the virus but have no outward signs of it, and unfortunately, they do carry it and can infect others, family members, and other people, causing illness and, unfortunately, in some cases, death. The governor remains very strong in directing that every individual in Louisiana age 8 or older shall wear a face covering both the nose and the mouth when inside a commercial establishment or any other building or space open to the public, whether outdoors or indoors. And this includes public and commercial modes of transportation. The Center for Disease Control is now also recommending that children aged 2 to 7 wear masks. The governor recently pointed out that the number of vaccines now approved and the others in the pipeline are showing us that the light at the end of the tunnel for recovery from this pandemic. Johnson & Johnson's vaccine looks very promising, and hopefully we'll get an approval within the next 2 to 3 weeks. One other characteristic of the Johnson & Johnson vaccine is that it is a one-shot vaccine and will be a major source of additional vaccinations if approved. The governor has acknowledged that statewide enforcement of his directives is simply not feasible, and he urges that we all be good neighbors and voluntarily and consistently comply with the prevention and mitigation protocols. Also of interest is that the first at-home rapid test kit will be shipped to the United States, or supposed to be shipped to the United States by the end of the month, after the President Biden's administration reaches a deal with the Australian manufacturer. But what we need now is for all of us to comply with prevention and mitigation protocols and to get through this crisis period. We can get through this tunnel, but we need to comply with these M&P procedures to get there with minimum impact on our citizens, numbers of deaths, and our local and national economy. The Center for Disease Control and Louisiana Department of Health have also announced that the number of days a person should remain in quarantine can be shortened to 10 days on day 11 if no symptoms have been reported during the daily monitoring period. Also, they've announced that the quarantine can be shortened to 7 days on day 8 if the individual takes a COVID test and receives a negative result. It's hoped that these shorter quarantine periods will encourage more people to receive the vaccinations when they become available. The Louisiana Department of Health is still recommending a 14-day quarantine for residents and staff of congregate living facilities, such things as nursing homes, and correctional facilities. The prevention and mitigation protocols have not changed, and as we do weekly, I want to just remind everybody of what they are. Wear a mask, covering your mouth and your nose. Wash your hands at least 20 seconds. Social distance of at least 6 feet. Do not touch your face, and disinfect surfaces you may touch, such things as doorknobs, rails, computers, those sorts of things. Cough or sneeze into the bend of your elbow. If you're sick, stay at home and follow the advice of your medical provider. And lastly, as always, avoid crowds. The impact of having a new president and his administration and directives is not clear yet, but according to Templeton newsletter, it appears that the early indications is that the president will invoke the Defense Production Act to ramp up our output of personal protective equipment gear for healthcare workers, and use FEMA, Federal Emergency Management Agency, to help set up vaccination distribution centers, and instruct the Department of Labor to issue emergency workplace standards for employers grappling with the pandemic. Governor Edwards is pleading that we all comply with the protocols for mitigation and prevention, and has stated that our best defense against spreading this virus to our family, friends, and throughout our communities remain these procedures. Ladies and gentlemen, the pandemic is far from being over. The vaccines are beginning to make a difference, but the challenge remains, and it will take all of us working together to survive this pandemic. I thank you for your continuing participation in our joint fight against this deadly pandemic. Our next scheduled briefing will be a week from now on February the 18th. This concludes today's briefing. Thank you and good day.